Independence. Individualised. Secure and private information storage in one place. Latest news. Service providers. Information sharing. Healthcare plans. Blogs. Budgeting. Newsletters. Calendar. Advocacy. A safe and supportive community.
My Voice, My Choice is a new place for people with a disability, their friends and families and carers to meet and talk about important issues online. It's also a place where people can store their private, confidential information and reuse it and share it with the service providers they need, whether that's an occupational therapist or a doctor or a disability service provider. But it's bringing together tried and tested technologies, video conferencing, document sharing, social media, but bringing it into a place that works for people who are buying services through the National Disability Insurance Scheme.
The idea for the project came from the feeling that with individualised funding, people needed a new way to connect with each other, to share their stories, to learn from each other and support each other. So we were using some of the latest thinking in social media about how people can connect in virtual communities. We were hearing lots of stories from people with disabilities and from families about the need to fill out forms here and forms there every time they went to a new healthcare provider or a new disability service provider. They were having to repeat information, update it constantly. This gives them control over that information.
Alex was born at 28 weeks, so that was basically 3 months premature. He's been diagnosed with cerebral palsy and also with Asperger's. And he's also had pervasive development disorder early on and feeding issues. We started to refer to it as a roller coaster because we just did not know from day to day what was going to happen and what curveballs were going to be thrown at us. We didn't have a guide or someone to help us through that process, so it required a lot of time and a lot of effort to go and gain that experience to work out how to work best with the medical professionals to help our son. If we'd had a website like this earlier on, it would have helped us, I guess, get started quicker and get to a high level of experience earlier and being mentored through the process and understanding how to work best with the resources available. You really need that local flavour. It is very dependent on region, and without that help, it can be really hard to navigate. I work in IT, so I've been looking through the system and I can see it's got a lot of potential there, and it can really help you focus on the important things, which are the family and helping them get the best care that they can when they really need you most.
Brenton has Down syndrome, but he also has dyspraxia. It affects his speech severely. He's always been a very sporty and active person and loves community and being with people. As he sums it up, I love my life, I'm living my dream. Well, it's going to be great in that we self-manage an individualised package, so the budgeting component of it's going to be fantastic for us in monitoring how we use the funds and keeping track of how much we've spent from month to month. It's really a fantastic tool. It'll build up independence for Brenton to be able to do it himself, because it's so easy to read and to access, to input the data, and to be able to train Brenton up to build his independence even further in taking control over this other part of his life. It's their voice and it's their choice, and it's the way it should be.
Amy has a condition. She was born with Down syndrome, but only 2 years ago she recently developed a health issue with non-epileptic seizures, which was brought on by anxiety. In families, you do become isolated when problems come up in your own family, and you try to deal with it as best as you can. And what you really would like to have someone at the end of the day just to pick me up and tell me some good stuff. When you're sharing stories that are similar, you're making a connection. You're making a connection even if it's one other person that's gone through a similar experience. And that's what you need. I think everyone needs a connection with someone. And if you start from a younger age, that support is with you all through their life. I find that people with children with disabilities are more open to share their stories and their experiences, just to alleviate that stress and worry to another family in similar circumstances. The more your life is made easier, the more your life becomes normal.
I had a normal pregnancy with Gracie, but unfortunately she was stillborn. As a result of her oxygen deprivation, she has cerebral palsy, she's blind, she has epilepsy and global developmental delay. I relish every day I have with Gracie, but the reality is that she's not going to develop past about 6 to 12 months of age. So I want people to imagine what it's like to have a baby in their life for the rest of their life. And a 3-month-old child who could have a seizure and pass away at any time. It is a pressure that you can't explain. There's a lot of mental noise that I carry around every single day that doesn't leave me. I even dream about it.
Hey, we go to the beach.
I'm the most aware of what Gracie needs, who she's seen, all of her reports. It's not easy to transfer that knowledge to my husband. At the moment, Gracie's documents are spread in a number of places. That's not ideal. They need to be better organised. If we are going to see a doctor in Sydney and it's a yearly checkup, for example, having access to the website will mean that I just have to take my phone or my iPad, and if the doctor wants to see something, I can either show him in real time or email a report, or have really easy access, and it means I'm not taking a big folder of stuff with me. We need to have an easy place to send that information or to store that information, and to be able to go paperless and to know that the documents are safe, they're not subject to being burnt, and this platform will just take a huge amount of pressure off my shoulders. I'm really looking forward to using the blogging and the sharing opportunities in the platform, because sometimes things happen and you feel the need to debrief, but you don't necessarily want to share it with the wider community. Social networking is great, but it's not always a safe place. I see that this platform will be a safe place, and my husband's looking forward to accessing the budget part of the platform, particularly in the future when we have access to NDIS and self-managed funding. He's an accountant, he'll think that that's the bee's knees.
The Trust has always been really well the same as ours, that people with disabilities are first and utmost in their charter, and they work that way, and I think that's a continuation of the culture. For me personally, I would definitely be looking to any type of I suppose software, computer applications, IT equipment that kept me going independently. Overall, the thing I like best about the database is it gives the person that control over their lifestyle.
Working with a client group of people who are profoundly disabled and have a lot of support needs and need staff care every single day and accommodation services, I think this is an excellent tool to help us link the client's everyday life with the family, so that they can check at any time what progress there is in healthcare, what the latest report says, what are they doing today.
I think for the clients themselves, it'll be chatting, it'll be contact with others. To the carers, it'll be what are we up to, what's next, where's my budget? And for the service providers, and once again, if consent's provided to share in this information, to interact with them much more effectively than we have in the past.
We're moving into a really tech-savvy group of carers, gathering information quickly, doing it after hours, providing support and mentoring to other families or other carers about their life's experiences and things like that. I think this website's going to be the catalyst to provide, I suppose, all of those opportunities for families, for carers and for people with disabilities. And I'd just like to say well done.
What was fantastic was just to see the feedback from the service providers that were in the room, and also the family focus group, and how they identified with the site, and I guess their excitement about this technology and the potential that it brings.
We were very fortunate to connect quite early on with Consult Point, and they've turned those visions that we had into something that I think is really special and empowering of people with disabilities.
My voice, my choice.